Hello everyone, this is Shad Reyes from SCAI 2024. I'm really privileged to be with one of the late breaker presenter, Dr. Reza Fazel, who presented about the temporal trend of femoral versus radial for coronary intervention in the United States. Thanks for being with us and congratulations.
Thanks for having me. Thanks.
Yeah. So tell us a little bit about the background of the study.
So there were kind of two main goals to this study. One was to look at the temporal trends in use of radial access in the US for PCI. And the motivation for that was generally the U.S. has lagged behind Europe and the rest of the world in adopting radial access. And the most recent data we have goes up to 2015. So, we kind of want to see where things are now in the U.S. And the second objective was to look at radial versus the impact of use of radial versus femoral access in terms of clinical outcomes.
Right.
Using a methodology called instrumental variable analysis that can it's a very helpful technique and actually can be used for causal inference as well.
Absolutely. So now we know our U.S. use of radial access, I think we're in the range of 50 to 60%, I'm assuming?
Correct. So we, in sort of the all-comer population, we looked from 2013 to 2022, and it went from roughly 20% to close to 60%. So a 2.8-fold increase over that 10-year period.
Nice. Okay. So now walk us through the population included and the main findings.
Of course. So again, this was all PCIs performed within the Cath PCI registry, which encompasses probably a majority of U.S. hospitals. And we looked for the temporal trend analysis, looked from 2013 to 2022, and was roughly 6.7 million PCIs. And that was to determine the temporal trends.
Yeah.
For the second part of the analysis, to look at the clinical outcomes associated with those two access points, we had to use a subset of that population, about 2.2 million PCIs.
Nice.
And we used more recent data because some technical issues with how the data is gathered. We want to use from when the most recent version of the data collection form from 2018 to 2022. We excluded patients for the outcomes analysis. We excluded patients who were kind of, for one reason or another, committed to femoral access, like patients in shock, patients needing mechanical support, where radial access is really, again, they have to be.
It's not impossible, but most likely they favor the femoral. Yeah.
Exactly.
So how is the outcome, and how is, you mentioned the trend going from 20 to 60% radial, but how is this outcome compared to the femoral?
Exactly. So one other thing I should mention about the trend, we also looked at operator level variation and use of radial access. And what we saw was there's a huge amount of variation with a spread all over the place from 0 to 100%. And I think that highlights the point that even though there's been a pickup in use of radial access, there's still a lot of room for further improvement and encouraging operators to use radial access more. In terms of the outcomes analysis, we looked at that 2.2 million population from 2018 to 2022. And what we found in terms of the clinical outcomes was that we saw that in this real-world population, we saw those findings that were in their clinical trials of improved risk of lower mortality, lower risk of major bleeding, and lower major vascular complications with radial access. And that's been seen in most of the randomized trials. One thing that we found that has not been seen in any trial was a small but statistically significant increased risk of stroke with radial access.
Which is, we know before, kind of radial access has been associated with some stroke, but never been...
Exactly, and there's always been a suspicion, and in some of the meta-analyses there's been a signal, like a trend, but not reaching statistical significance. And since this is such a large population, I think it has the power, and it is a small signal. So I think the trials that typically include a few thousand, or some of them even a few hundred patients, just don't have the power to detect that. But since this is such a large population, we were able to see that.
Yeah. Did you look into gender differences in these studies?
So we looked at factors associated with radial use, but we didn't look at the nature of. We adjust for gender in this, but did not look at specific gender-based differences.
Yeah, and when you mentioned better outcome, was it the mortality difference or just bleeding and transfusion?
All three. So there was reduced mortality, reduced major bleeding from the access site, and reduced major vascular complications other than bleeding. So all three of those were lower with radial access. And we actually looked at subgroups of patients, STEMI, non-SC elevation ACS, and non-ACS groups, and you could see a gradient of the benefit where in the STEMI group you saw the greatest benefit with the biggest mortality reduction, the biggest reduction in major bleeding, but also a little bit higher stroke risk. And then in the non-ACS group, the mortality benefit was not there anymore, but there was still an advantage in terms of reducing major bleeding and major vascular complications.
Which is consistent with SAFARI trial.
Exactly. So the higher risk the patient, the more the benefit of radial access.
Radial access. Well, I mean, congratulations. This is a great trial. I mean, and again, emphasize on the importance. It's interesting. We see like there's a trend, as you said, twofold increase over the course of study period.
2.8, yeah,
2.8.
over the past decade.
Yeah. So hopefully, 10 more years now, we'll be in the 80.
I hope so. Yeah. Hopefully, that trend won't plateau and it'll continue to grow.
Absolutely. Yeah. Especially with the new training and the fellows getting trained more on radial, I think that's definitely.
And I think it's highlighted in meetings like these. So I think with support from professional societies, continued education, hopefully that will continue to grow.
Absolutely. Well, thank you so much and congratulations for the trial.
Thank you for having me.
Absolutely. This is Reza from SCAI 2024 in Long Beach. Thank you so much for watching us. Thank you.